Hello, YouTube. I gotta fix your camera. Ugh. Come on, camera. Be good. Okay, is that better? Oh, there we go. All righty then. Hello, my friends. It's Jill Osborne. Jill Osborne from the Interstitial Cystitis Network. It is Sunday, January 12th of 2025, and it is time for another live support group meeting. My purpose in doing these meetings is to make you strong, knowledgeable, informed. Our goal here is to support each other, to encourage each other, to give each other a cyber hug because life with chronic pain is hard. It can be very, very hard. Believe me, I've been there. And I'm still there now because I have a lot of chronic pain from my breast cancer surgery. I am the founder of the Interstitial Cystitis Network. This is a support group meeting for men and women who struggle with pelvic pain. You might have bladder symptoms. You might have rectal symptoms. You might have vulvodynia. You might have a lot of skin sensitivity. Your symptoms might have started after you fell on your tailbone or after you had surgery. Your symptoms might have started because you thought it was an infection. Some of you think you've had infections for many, many years, despite the fact that you have a normal bladder and they rarely find infection. That, my friends, is what we call a chronic pelvic pain syndrome. Now, in years past, this was diagnosed as interstitial cystitis, but we're changing names. And most of the world no longer uses the name interstitial cystitis. Interstitial cystitis is not a disease. Interstitial cystitis, again, is a bladder or pelvic pain syndrome. Now, we've learned a lot in the last 30 years. We've learned that most of us don't actually have a problem with our bladder. For 85% of IC patients, it is neuromuscular in origin. So we have another new name. It is called Myofascial Frequency Urgency Syndrome. And that, my friends, is probably going to be the dominant name that we're going to be using in years to come. Myofascial frequency urgency syndrome. So what does that mean? That means that your frequency urgency is actually being caused by muscles and fascia and potentially nerves too. Hello, Deborah. Right now we're simulcasting. So if I'm looking over here to my left, I'm looking at our YouTube stream. If I'm looking straight ahead, I'm looking at our Facebook stream. So it's been so normally when I do these meetings, I do a little 30-minute intro, and then I'm happy to take your questions. Sometimes we go long. Sometimes our meetings will last 2 hours. Sometimes they'll last 5 hours. I was not here last week because I realized that while everybody else was off for the holidays, I wasn't. I worked every day through the holidays. And finally, last Sunday, I realized I needed a break. So I gardened. And so I want to thank you for being patient with me since I was not here last week. Hello, Donna. Hello, Christina. Christina says, muscle tension coming from the brain. Yes, if you are a widespread pain patient, then what that means is that we have a central nervous system that is injured. And one of the ramifications of having injury to the central nervous system is that muscles get tight. Muscles stay tight. Hello, Denise. Nice to see you, hon. Very, very nice to see you. So I've had a lot of people ask me if we've been affected by the fires. So in California, we have had literally probably one of the worst, not the worst, because I lived through the worst, but one of the worst firestorms in history. And that is there are 4 fires right now that are down in Los Angeles, Pacific Palisades. There are several of them. And more than 1,000 homes have been burned. In 2017, I lived through the Tubbs fire. We had 5,000 homes burned. We had about 23, 24 fatalities. And these were people who were trying to get away from the fire and they couldn't. Some people died in their garages. The fire consumed their home before they could get away. Some people were running through the streets in their pajamas and the fire caught them. I will tell you that life today in California is very different than it used to be. That I spend, especially when I was caring for my elderly parents, if we had what we call a red flag alert. So a red flag alert day is our highest fire alert day. And generally, what that means is that the winds are staggeringly high. In fact, our winds last night were very high. Down in Southern California, they call them Santa Ana winds. And so all of California had very, very, very high winds earlier last week. The difference between where I am and where the fires are right now is that we've had a lot of rain, so our hills are green. So in fact, I thought I smelt a fire yesterday. If a fire started up here right now, it would not go far because the hills are covered with green grass, and green grass doesn't grow, doesn't burn easily. In contrast, in Southern California, they have not had rain for months. And their hillsides are brown and dry, and they are ready, and they burn like tinder. So it brings back a lot of PTSD on red flag days. For those of us who live here, we are hyper vigilant. You cannot sleep on a red flag day. You are an idiot to try to sleep. You have to monitor the fire news because these fires move very, very quick. They will move 2 football fields in a minute. And I almost lost my house 2 years ago. So anyway, I just want to make a couple of things really clear because I think it's my responsibility as a Californian to say this. This is not a forest fire. There are idiots out there who are saying we have bad forest management practices. This is not in a forest. This is a brush fire. Okay, that's concept number one. Concept number two is there's not enough. There would never have been enough water to defeat these fires. There were too many of them too quickly. And so let's not start blaming and making California look bad. Honey, we have gotten through this before. We're going to get through this again, but this is absolutely heartbreaking. And it's heartbreaking for everybody who loses their home, as well as the entire community that supports them, from the people who run the gas stations to the 7-Eleven, to the grocery stores, to the churches. They're all gone. They're all gone. And I realized this year I could easily lose my home. Easily. If I look out at that hillside right now, that hillside has already burned twice. Okay. And so it's very chilling for me. It's very chilling for those of us who have lived through this and run for our lives. So on those nights when it's a red flag alert, when I was caring for my elderly parents because they wouldn't leave right away, all I did was monitor evacuation routes. And I will tell you, on several occasions, I was blocked by fire on all 4 sides. All 4 sides. I couldn't go north, east, south, west. Couldn't do it. So I became a master at little back roads. I learned, this is going to sound crazy, that when you evacuate, you don't go away from the fire because the roads are blocked. It'll take an hour to go 6 blocks. I've learned you actually go towards the fire first, and you look for the little side road to get yourself away. I mean, it's crazy. Anyway, so to anybody out there in Southern California who are going through the fires, my heart breaks for you. If there's anything that we can do to help you, please don't hesitate to ask. We're your sisters and brothers. We understand the heartache. We understand the fear. And I truly hope that you feel our love and our comfort. All right. So we've got somebody on Facebook here. Guys, please do not come into our support group meetings and try to sell stuff, huh? Like, seriously, that's just not okay. So hold on a sec. Okay. Okay. Let's see. Hold on one sec. We already have questions. Katie says, "Hope you're feeling better." Yeah, getting there. I'm 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 gonna I'm so the other thing that I kind of wanted to talk about before we get to your questions is I wanted to talk to you about the concept of loneliness. Because if I have one dominant theme in my life, it's feeling lonely. And I'm actually working with a therapist right now, again, because I don't want to. A lot of people think, "Hey, you're on the IC network. You're kind of famous. Why are you lonely?" Well, it goes back to being a kid who was sick. A lot. When my friends were out getting married and having babies, I was in my bathroom in agony. And slowly but steadily, after something like this happens, your friends drift away, and you're at home desperately trying to feel better. And you don't know what's wrong. All you know is you're not getting a fair shake at life. All you know that you've got family members and friends who look at you like, really? All you know is that you've got doctors out there who don't quite get it. My job as a support group leader is to show you that there is hope. My job as a support group leader is to educate you, to inform you, to give you, to open new doors, to open new windows, to show you that truly there is hope. But there are moments that are incredibly lonely. I think it's really, really important that how do I want to say this? When I was at my worst, I felt like I was damaged goods. I felt like there was something so fundamentally wrong with me that I was almost unworthy of a normal life, because years of pain kind of gnaws away at your psyche. It affects your self-esteem. It affects your relationships. It affects everything. The turning point for me was when some of the very first research came out that showed that nerves were involved, that genetics could be involved. Up to that point, I felt like this was my fault. I didn't know why it was my fault, but I felt like for some reason my life was my fault. But then the research started happening, and research started talking about nerves, and research started talking about how nerves in the pelvis talk to each other. One of the first fascinating breakthroughs was when we had a study that talked about how we called it the pepperoni pizza algorithm. We learned that if you irritated the bowel, the bladder would show signs of irritation. We learned that if you irritated the bladder, the bowel would show signs of irritation through something called neurocrosstalk. All happens at the spinal cord. Turns out the nerves for your bowel and the nerves at your bladder merge at the spinal cord. They actually become the same nerve. Okay. Then we had the research come out that talked about the role of muscles. It's in 2008. Doctors had long described muscles so tight they were like tight piano strings. But urologists never did anything about that. Urologists were focusing on bladder, bladder, bladder. They weren't looking at tight muscle, tight muscle. until a very wonderful physical therapist named Rhonda Cotterinos came to a national IC group and said, "Hey guys, you keep talking about these tight muscles. What are you doing about these muscles?" And that was huge because my symptoms started in seventh grade after breaking my tailbone. Because as soon as you start talking about muscles, you start talking about injuries. Gee, have you ever been hurt before? Have you fallen? Were you doing sport? Oh my God, who was I working with? I was working with this week a guy who was what was his sport? Not rugby, something like that. And here he'd had frequency urgency for 10 years and was living with a lot of pain, terrible pain. And yet he could eat anything. Why? It made no sense. Been on antibiotics forever, prostate meds forever, bladder treatments forever. Nothing worked for him. And I said to him, I said, "Has anybody looked at your muscles yet?" And he's like, "No, why?" And I said, "Well, do you realize that like 85% of IC patients' symptoms are actually coming from injuries? And that's supported by research? Myofascial pelvic pain syndrome?" He's like, "Oh." And so many of you, I'm amazed at the number of patients who call my office who still haven't had a pelvic floor assessment. Like the single most important examination that our national guidelines say should be done at the very first appointment, you're not doing. You have got to get your muscles checked because this is about not guessing what's causing your symptoms, it's about facts. We can't figure out the right treatment for you until you have a proper diagnostic evaluation. And the single most important diagnostic evaluation is, in fact, checking your muscles. Let's see where they are. So, anyway, getting back to the concept of loneliness here. Here for 20 years, I believed that this was kind of my fault. And guys, I had a master's degree in psychology. But underneath it all, there's just this little part of me that was like, what did I do wrong to deserve to be punished this way? And when the muscle research came out and the role of trauma came out, the light bulb turned on. It's like, oh my God, wait, this isn't my fault. I mean, like seriously, this all began in seventh grade when I broke my tailbone in half. Oh my God. Wow. That was so important for my self-esteem to transition from "it's your fault" to "oh my gosh, you were hurt. You were injured." And this is what happens when you sustain a tricky injury, a tricky pelvic injury, a tailbone injury, a hip injury, an SI injury. So I don't feel shame anymore. I don't feel blame anymore. I know that my symptoms were never my fault. And I want you to hear from me right now. This is not your fault that you have IC. Stop blaming yourself. You were hurt. Don't think of this like an incurable bladder disease, because for most of us, it isn't. For most of us, it's a neuromuscular disorder slash injury. Again, myofascial frequency urgency syndrome is the new name. Okay. But what do you do during the 20 years when you're trying to figure out, or the 5 years, or the 3 years, or the 1 year, when you're just trying to figure out what's wrong with me? Please, God, help me understand what's wrong with me. It is a very lonely journey. But you're not alone. You have tens of thousands of brothers and sisters who have gone through this. Use us. We have wisdom to share. One of the reasons why I decided to go back into therapy was because I was just really traumatized by breast cancer. And it brought back all of the loneliness because you go into the OR alone. You come out the OR alone. You drive yourself to the ER alone sometimes, most of the time. And I'm sick of it. I'm sick of it. And so I just decided it's like, you know what? I'm going to work on some trauma stuff. So I'm doing an EMDR tapping protocol with this new therapist. And it's really interesting because it's allowing me to go back to those moments when I felt very desperately alone and to kind of, and it's like, I give you an example. I'll give you a really, really good example. Um, because remember, it started when I was very young. So I truly, I was always the kid on the outside. I was never the popular kid. And when I worked for the University of California, Santa Barbara, when I was in college down there, I had just a truly terrible boss. Like literally somebody who absolutely enjoyed humiliating me and other people he didn't like. Like if I could see him now, I would just like go, "Why? Why would you do that to young men and women?" Obviously, he had some mental issues. And so we were kind of what she's having me do is she's having me go back to those moments when I felt the most lonely and just kind of comfort myself in a very, very interesting way. And one of the things that came out, which shocked me, is that I really wasn't that I wasn't as alone as I thought I was because there were a group of women who saw what was happening to me and they took me under their wing. If I were crying, if I were upset, if they witnessed me being verbally abused by this man, they came and got me. They wrapped me in their arms. They acted on my behalf. They testified for me. And so it's interesting that 30 years later, my brain goes lonely, lonely, lonely. But when I actually go back into that moment, it's like, but you really weren't alone. There were people who were trying to help you. And that was just a big light bulb moment for me this week. I thought it was fascinating. And so I say this to you because I want I don't want you to carry the same burden that I carried because we've learned so much about IC. I mean, back when I was diagnosed 30 years ago and when I started experiencing symptoms 45 years ago, we didn't know anything. That's when they told men and women it's all in your head. And so we truly thought it was all in our head for a while. Now we know that that's just not true. Now we know that this is, in fact, injury or trauma. And our job now is to try to understand and define that injury and come up with the correct treatment plan for your specific injury, your specific trauma, your specific phenotype. So, anyway, I'm just kind of doing a lot of contemplation right now. And the other thing I really, really encourage you to think about is good stuff in, good stuff out, bad stuff in, bad stuff out. And as I was looking at all the fire stuff and looking at the people coming in and saying incredibly rude and cruel comments, it's like I really truly feel like some portions of the internet are like poison now. And I'm working really, really hard to step away from all that. I'm painting, I'm crafting, I'm watching comedies. What I am not doing is spending hours and hours looking at social media anymore. It's just not, it's not soothing to our soul. And I don't need to watch somebody else fighting. I don't need to watch somebody else yelling. I don't need to read comments from people that have no role in my life that are aggressive. I want to create a sanctuary for 2025. I think we're all going to need a sanctuary this year. So I encourage you to do that. Okay, so getting back to IC stuff. I did put out the new video on my research. And so for those of you who are not aware of this, we now have a 4-year follow-up study, which is involuntary maculopathy caused by Elmeron. Actually progresses after you stop the medication in many patients. And so if you are in litigation over this, if you are in settlement talks over this, please come over to the IC Network, print out the article. I've got all the research, give it to your attorney because I think this might increase your settlement. If you are considering using Elmeron, I would really strongly encourage you to not jump on the bandwagon right away. I would encourage you to look at this research because this research is absolutely devastating that in fact some eyes are becoming atrophied. Now, there are some patients who say that there's nothing else for them to do but Elmeron. And it's like, well, no, number one, we have to understand your phenotype first. Because Elmeron doesn't have a bat chance in hell of helping you if you're pelvic floor driven. It does not have a bat chance of helping you if you are a widespread pain patient. The only scenario where Elmeron makes sense is for patients with estrogen atrophy, patients who have a compromised bladder wall for one reason or another. Elmeron does not help Hunner's lesion. So we're long past the days where doctors just wrote Elmeron prescriptions for every patient. I mean, we know flat out that it does not work for many patients. And now that we have phenotyping, we don't want to waste your time and money doing a therapy which has no chance of helping you, period. Secondly, the method of action of Elmeron is to act as a coating. It's a chemical Band-Aid. And so we have other things that can act as a chemical Band-Aid, specifically the chondroitin-based supplements like Bladder Builder, Bladder Rest, Cystoprotect, and Cystomend. And we're getting our next Cystoprotect shipment has already been shipped to us. It's sold out right now, but we should have it this week. And Bladder Builder, we still have plenty of Bladder Builder and not quite as much Bladder Rest, but that will be coming in. Our AUA guidelines are very clear. They say, if you're not responding to therapy, if you're getting worse rather than better, stop what you're doing, take a step back and revisit the diagnosis. What have we missed? Because seriously, if you have done Elmeron for 20 years and you're still flaring, it's not working. I was working with another patient who just, it's always so interesting, the patients who call. I mean, I love talking with you. Truly, it's the best part of my job is working with patients. And it's amazing the number of patients who call, and I'm thinking of one in particular, they've tried everything. Like, Jill, I've done everything. I don't know what to do next. I had one patient who was having very, very dark thoughts. Nothing had worked for her until she severe Hunner's lesions. And then she was, if you're watching, you know who you are. You saw our discussion about lactoferrin, and she's been on lactoferrin for 2 months. And you know what? She's better. She's 70% better. This was a woman who was at her wit's end in a very, very psychologically vulnerable spot. And she just decided she was going to try something else. She did the lactoferrin, and she's better. We are saving her life. This is exciting. So If you're not responding to therapy, if you're getting worse rather than better, don't keep doing what didn't work. Some of you keep saying bladder disease, bladder disease. I need a bladder treatment, bladder treatment. That's all I'm going to do. I'm going to do a bladder treatment. Others of you just say, I want antibiotics. I want antibiotic. Give me antibiotic. It's like, and when you call me, I go, well, okay. I don't even want to hear about the treatments you've had yet. I want to know what your phenotype is. So let's talk about your symptoms first. And usually within the first minute, I've got their phenotype figured out because I know the right questions to ask. And so anyway, stop guessing, stop doing things that aren't working. If there's room for improvement, if there are things that you would like to improve, let's take a step back and consider some new possibilities. A lot of you will have just refused to get your muscles checked. It's like, come on, what do you have to lose? I was working with the parents of a young man who had been diagnosed with IC. I've worked with several young men in their early 20s who have been in terrible shape. And they've been on antibiotics. They've been on all the IC treatments. They're not getting better. And nobody has checked their muscles yet. And, you know, you're contemplating doing experimental treatments. You're contemplating spending tens of thousands of dollars flying to another part of the country to try something new. It's like, wait, you're guessing. We need facts. And you have not had the single most important diagnostic test, which is getting your pelvic floor checked. And one of the things we consistently see over and over and over again are people who get hurt weightlifting, especially young men, but women too. If your symptoms started while you were doing extreme lifts, that is a pelvic floor injury. And in this one case, extreme lifting developed a hernia, had to have surgery, absolute muscle injury. They just didn't realize that the injury could extend down into the pelvis. Hold on a sec. Donna says she was in a lot of pain over the holidays. You're feeling a lot better, just waiting to get into physical therapist. Yeah, people are very busy right now. It's very, very hard to get immediate appointments. Like I need to go have an echocardiogram for my heart. Just, you know, I just want to kind of understand, you know, how my heart is doing right now because I've had some weird heart stuff in the last couple of years, and I can't get my appointment until middle of February. I'm annoyed about that. I'm sure it's fine. I'm sure it's fine. I just want a look. Doris says, I'm praying so hard for you all in the fire area. You've been in my prayers. You've helped me so much with my IC more than my urologist. May God bless you and everyone affected by the fires. Honey, thank you so much. And no. Somebody on YouTube says coffee enemas for pain relief. Absolutely not. No. Patients who have widespread pain, patients who have pelvic injuries and have neuroinflammation. And it's that neuroinflammation that's driving a lot of these symptoms of frequency, urgency, pressure, pain, IBS attack. The last thing you want to do is to put coffee down there, which is neurostimulatory. Utter foolishness. No. And the other thing that's just really important is we're now really understanding the biome and the importance of the biome in the vagina, in the bladder, in the bowel, and doing cleanses and things like that disrupt the biome. We don't recommend those anymore. Well, we've never recommended them. We have never recommended them at all. They just pulled their, okay. So thank you. I'll see you later. All right, hold on. They're going on a timeout. Okay. Julie says, I want to go out and help in Los Angeles to help the animal shelters. Oh, yeah, man. Did you see the guy? There's a great video of firefighters who had gone into an animal refuge and they were carrying out baby fawns, literally with the fire like 10 feet away. just arms filled with baby fawns and deer. And one guy was carrying a baby fawn, and another fawn was walking right behind him, staying right next to his leg. I mean, these fires are just they're just devastating. They're devastating to the animals in the fields. I mean, listen, we have a lot of mountain lion, we've got bobcat, we've got a lot of hawks and eagles and um, raccoons and possum and things like that. And you got to understand that they get wiped out. What is it? They can't outrun the fire. I was just thinking that one of our fires that we had, I think it was the first one in 2017, there was a field. And remember, it's a football field a minute. That's how quick it travels. The animals get tired. And at some point in time, they stop. So we have had deer jump into pools. But in one case, there was this glorious stag who just fell down and the fire took him. And so, ah, whenever I see a dead animal on the road, I always say, "Peace with peace, uh, peace within your beautiful soul," something like that. Because I have a hard time understanding the lot of animals out there. I love animals. All right, Karen says, "What can I do to calm a flare? My lab shows blood and urine and no infection. I'm waiting for a urology appointment, but I'm in the meantime in a lot of pain." All right, Karen, so it depends on what kind of flare you're having. You could have a bladder wall flare, or you could have a pelvic floor flare, or you could be having a stress flare, or you could be having a hormone flare. Each has its own treatment plan. So if you come on over to the IC Network, icnetwork.org, and if you sign up for our free newsletter, our gift to you is a 40-page flare management guide with hour-by-hour rescue plan. So, for example, if this is a flare after sex, or if this is a flare because you took a long car ride or you've been traveling, that is a pelvic floor flare. So, a pelvic floor flare, our goal here is to get to calm and relax pelvic floor muscles. So what are we gonna do? We're going to, number one, grab a heating pad. And that's the most common kind of flare that I get, pelvic floor flare. So if I'm in pain for 30 minutes and it's a burning pain, sometimes it's a vaginal pain, sometimes it's a pulling sensation or a pushing sensation, I will go grab my heating pad, heat it up, get it really hot, lay in my recliner for 30 minutes, throw heat on it, see if I can get the heat to relax the muscle. This is where taking a hot shower, hot bath is really, really good because heat relaxes muscles. Um, if an hour later we're not making the progress we're going to make, then that's when we're going to do a muscle relaxant like baclofen or Flexeril. If you've already been diagnosed with pelvic floor dysfunction, odds are you already have a muscle relaxant that you're having on hand. And so I will do like a quarter of the lowest dose of Flexeril, a quarter of a pill. And if I'm traveling, but I'm not driving, but if I'm a passenger, I will do a quarter of a pill every 2 hours for the duration of the trip to keep my muscles chill. Some patients have vaginal Valium suppositories or rectal suppositories. That's a good way of getting muscles nice and calm. Medical marijuana is another thing that can really relax and calm muscles. And then if you have a wand, hopefully you have a pelvic wand, you can actually use your wand internally to try to figure out and find that muscle that's tight and work on rubbing it and relaxing it gently to get it to release and to make it better. Okay. So and then if you're still not getting better, getting yourself to that physical therapist is important. Now for a bladder wall flare, we're going to be very, very different. A bladder wall flare is going to come from food. A bladder wall flare is going to come from something you've eaten or drunk that day. Maybe you've gone to grandma's house, whatever, and you've eaten something, and now we've got a pretty wicked flare. Um, So let's say uh, you had a glass of champagne, or let's say you had spaghetti sauce, something at all like that. Our immediate goal here is to reduce the acid level. So the first thing we're going to do is we're going to drink water to dilute it. The second thing you can do is you can alkalinize your urine with some Pre-Leaf. The sponsor for this meeting actually is Pre-Leaf. They sponsored the IC Network for years. Pre-Leaf is an over-the-counter supplement based on with calcium glycerophosphate that you can take with acidic foods to reduce the acid irritation. So you can alkalinize your urine with Pre-Leaf, or you can alkalinize your urine with a little tiny bit of baking soda, like a quarter teaspoon baking soda in a glass of water. Let's see how you do with that. If with it, again, using some heat to keep these muscles relaxed is really, really useful. You can go to azo bladder pain relief tablets or pyridium if you happen to have a prescription for pyridium, because these act to numb the bladder wall. And you're kind of in a position of writing it out. Hopefully, this diet-induced flare will last a day or two, and then it will slowly get better. That is our goal, for it to slowly get better. You could potentially call your doctor and ask for a rescue installation. But I was working with a patient on Friday who was having a cup of coffee a week. And as I explained to her, I said, listen, your bladder cannot heal with one cup of coffee, destroy an entire generation of cells trying to. So if you're having one cup of coffee a day, you're screwed. You're absolutely screwed. Your bladder simply will not be able to heal because it's destroying stem cells. This is why we want you off of coffees and sodas and really, really strong acids for 3 to 6 months to really give your bladder an opportunity to heal. And then once it's actually healed and repaired itself, you might be able to come back and do maybe some lower acid coffees or some herbal coffees like Dandy Blend. Okay. If it's a hormones flares the day that you ovulate, a couple of days before your period. Those are very short term. Heat, usually you just kind of have to ride through it. Maybe a little bit of azo, stuff like that might be a little bit helpful for a hormone flare. Um, and then for a stress flare, my friends, deep breathing. Because when you're under stress, what's happening? Your heart rate's going up, your blood pressure is going up, and your muscles are getting tight. So the stress flares are often pelvic floor flares. So we want to make sure that we are doing everything we can to calm that stress, to reduce that anxiety, to let things go. Hope that makes sense. Sneaky says, I've been having some pain today and would love to talk a little. Major pulling sensation around my vaginal area and some urgency burning sensation on the vulva. Okay, so that pulling sensation is not your bladder. That pulling sensation is your pelvic floor. And that's exactly what I have had that many, many times related to my tight pelvic floor muscles. But Sneaky, maybe at the end of this meeting, we can go into Zillow. And I mean, not Zillow. Oh my gosh, Zoom. Does anybody else do what I call Zillow porn? And that's where, a couple of times a week you go to Zillow and you look at all the homes that are for sale around the country and you go, oh, I'd like to live here. I'd like to live here. Okay, guys, please do not come into our into our meeting and try to sell stuff. You're better than that. I just kicked them out. They just look for anybody live doing health stuff and they come in and promote a lot of herbal stuff. Okay, let's get back here to Facebook. All right. Really, guys, Macklin, I'm sorry. No, this is not the place for you to promote stuff like that. All right. Who is it? Elizabeth says, and Elizabeth, bear with me here. My stream goes up and down on Facebook, and sometimes it doesn't let me go back and read stuff. So, okay, now I can see it. Oh, come on. It's being so weird. Hold on. As you address those of us who have end stage IC, nothing that okay. Ah, hold on. My screen keeps jumping. Like I'm getting through the first 3 lines and I can't read the last 3 lines of what you're writing here. Those of us with severe IC need to have the support of others and you. Elizabeth Ann, thank you, honey. Thank you, thank you, thank you. So let's talk about end stage IC. An end stage bladder is a bladder that has become very small and fibrotic. And generally, end stage bladders often occur as a result of a lot of chronic infections. They can result from Hunner's lesions that are not responding to therapy. It's very frustrating to be a patient who's been told that they have an end stage bladder. Now, a lot of you are going, is that going to happen to me? And the answer is no. Again, now that we know that 85% of IC patients are neuromuscular, it's not a big risk for most of us. I don't believe that I will ever have an end stage bladder. But for those of you who do have an end stage bladder, I'm so sorry because that's hard. You've tried a lot and things just haven't worked well. So, so there are options here. I mean, option number one, again, and now that we've got lactoferrin, and we've got a really good research study showing that lactoferrin made very red inflamed bladders, pink and healthy bladders, and Hunner's lesions virtually disappeared. For anybody who's close to an end stage bladder, I would just say, what do you have to lose? Why not give the lactoferrin a shot? It's fascinating. It's the data behind lactoferrin is fantastic. It is not a synthetically manufactured chemical treatment. It is a protein found in milk that helps to build our immune system. And Melissa here says lactoferrin assimilates iron. Is that an issue for women needing to minimize iron intake? You'll have to ask your doctor. If you have a condition that means you have too much iron, I would think that lactoferrin would be better, but your case might be very, very complex. So you're gonna have to talk to your doctor about that. That's outside my wheel well. I'm really not sure on that. I can't give you a good information on that because I just don't know. But it's a very, very good question. So anyway, getting back to the end stage bladder. Number one, you might as well give it a shot. Number two, can we please phenotype you? If you've never been phenotyped, let's at least phenotype you first, just to make sure we haven't missed anything. Number three, you know, there are patients who do not fit the typical easy model, like me breaking my tailbone. Okay, that's super easy. There are other patients out there whose symptoms and their bladder condition has gotten worse and worse and worse over time, and they just haven't been able to figure it out. And this is where we really have to look outside of the box a little bit more. And there's a fabulous book. Here it is. Facing Pelvic Pain, that I encourage anybody with really severe IC symptoms that do not appear to be responding to treatment. This book is free on Kindle Unlimited, so no excuses. Get it. If you've got Kindle, you can get it for free. The reason why this is important is that this looks for the other related conditions that can be contributing to your bladder health that might have been missed, from rheumatological conditions, gynecological conditions, gastrointestinal conditions, even something like Lyme disease. Lyme disease. We know that frequency urgency is very common in patients who have Lyme disease because that a critter actually arrives in the bladder. And I'm trying to remember the name of the Lyme disease. I don't. The name of the bacteria is on the tip of my tongue. Anyway, untreated Lyme disease could be playing a role. So you to me are somebody where, man, we have got to look much, much bigger and look for the other rare, unusual things that might be contributing to your poor bladder health. This book is a great place to start. You're welcome to call me. I'm more than happy to look through that too. And let's see if we can find any other sneaky things. Um, Things like I was working with a patient last week who had multiple fibroid tumors, and she's in constant pain. And it's like, well, what's going on with the fibroid tumors? And her answer was, I don't know. And I like, do you know that if your fibroid tumor is on the front of your uterus, it is literally pushing against your bladder, and that can be causing a lot of symptoms. There may come a point in time for an end stage patient to look at surgery. They can do an augmentation in the bladder to increase bladder capacity, or they can do a cystectomy where they might remove. And this is a very small group of patients, lives for the better. We have in the IC network support Carol, who ran our cystectomy board for many, many years. There's a patient who had a cystectomy, and it completely changed her life for the better because she no longer had to find the bathroom. She had a pouch. It was just so wonderful not to have to run to bathrooms. It was so wonderful not to have your life limited by restroom access. Uh, Cystectomy is, I mean, it's brutal surgery. It takes a lot to get through it. Need a lot of help to get through it. When I was 33 and I was diagnosed with IC and my pain was so terrible, I begged my doctor to take my bladder out. He said no. He said, Jill, we haven't even done anything yet. I'm not taking your bladder out until you try treatments. And I'm like, but I don't need it. And he's like, yes, you do. And that's a normal thought for some IC patients. It's just kind of like cancer. The cancer is like, hey, if I got cancer, take my breast. I don't need it. If I've got a problem with my bladder, take my bladder. I don't need it. No, 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 no. You need your bladder. We want to keep your bladders as long as we can. And it's very rare that a patient ever progresses to bladder removal. But for those of you who might have very, very damaged end stage bladders, that might be a viable option for you. Now, our national guidelines say the best candidates for bladder removal are patients who have Hunner's lesions not responding to treatment. If you've got pain beyond your bladder, if you've got widespread pain, if you've got pelvic floor dysfunction, then there's a chance that if you have your bladder removed, you'll still have pain because your pain's not coming from your bladder. Your pain's coming from something outside of your bladder. End stage bladder is difficult, but you're not alone. Also, one other thing that I would just say is listen. If you've had a local doctor tell you you have end stage bladder, maybe it's time to go to a regional doctor or a national doctor. Well, let's get that confirmed. Why not do that? Hey guys, I need to take a bathroom break real quick, which I rarely do, but I've been drinking a lot this morning. Give me 30 seconds. I'll be right back. All righty. You know, I did wash my hair, but it does look a little bit on the challenging side right now. All right. Okay, so to wrap it up with end-stage bladder, if you just don't know what to do and you've been told that you've got end-stage bladder, it's time to up your game. Maybe go to a more experienced doctor, maybe go to one of the national doctors. Let's see if they can find something that your doctor might have missed. I hope that makes sense. You're not alone. And I'm sorry. I'm sorry you're going through that. All right. Facebook is just being so weird. It's jumping all over the place. Loretta says, "Oh my God, stop jumping." It is all over the place. And I'm in Chrome. It shouldn't be doing this. Francis said, "I flared with Flexeril. Any idea why that might have happened? No, it doesn't make sense at all. I'm positive it was that because I tried it 3 times with no success. I thought maybe it was a blue coating. That's possible. There's some patients who do struggle with some of the dyes used in meds. I've got one good friend who actually can only take pills that are white. So maybe baclofen. Harriet says, my new provider provided medical marijuana. Christine said, hope you're doing all right in Scotland. Chronic blood. Hey, girl, nice to meet you. Welcome from Scotland. Um, chronic bladder pain, 40 years. I'm 64. We're the same age. Yeah, baby. I'm now doing weekly catheterizations of Ioloril. I have diagnosed hypertonic pelvic floor muscles. I have seriously painful urethral symptoms, which come on suddenly. And a couple of hours later, they will be gone. Pelvic floor flare. That's your levator ani muscles probably spasming around your urethra. Since they go away so quickly, that's what that probably is. You do pelvic floor muscle release exercises. You've tried PEA with no relief. I've been single now for 15 years. I cannot be in a sexual relationship. My life is coping with pain and discomfort. I have fibro, post-traumatic stress disorder. Most people don't understand why I have to cancel plans and reschedule. I now keep to myself and don't make plans. It gets old. You just had to vent. Girl, Christine, honey, believe me, I have felt exactly what you have felt many times. So the fact that you've got PTSD, like I have PTSD, and the fact that you have fibro tells us that you've got multiple things going on. You have tight pelvic floor muscles, but the question is why? Why would you have tight pelvic floor muscles? And the answer goes back to being in a state of stress and anxiety, PTSD. And so, what I would be adding to your care plan, I mean, there are a couple of things that I would add to your care plan. Number one, you got to keep on the pelvic floor because whenever you're under stress, you tighten your muscles. So, you really got to work on keeping that pelvic floor as calm as you can. And the way we do that is by calming your central nervous system also. So, I would be diving into maybe learning some really good new anxiety management techniques. I took an anxiety management class that changed my life 30 years ago. I have not had a panic attack since I've taken that class, but I would be very honest in saying my medical anxiety has risen with a breast cancer diagnosis. And that's one of the reasons why I'm back in therapy is I want to learn new techniques because I don't want to live feeling anxious all the time. I did that decades ago. I don't want to do it again. And I understand now that it's not my fault. I haven't done nothing wrong. I've been traumatized. You've been traumatized. It's okay to learn new techniques to help us understand trauma. So there's no shame in loneliness. I understand not being in that relationship for a period of time because you have been through some stuff and your body is a reflection of what you've been through. But don't let that diminish your self-esteem, honey. There's None of this is your fault. You just got hurt. Yeah, PTSD. You've been through trauma. I've been through trauma. And the way our body responds to that trauma explains some of the symptoms that we deal with today. And the blessing here is that this is not all in your head. This is not mental illness. This is not schizophrenia. This is a trauma response. And we get to learn new techniques on how to handle trauma. And so be open to trying some new mind body medicine techniques, to be open to trying some tapping. There are lots of things that we can do to just try to bring down the volume of the stress and trauma in our lives. Understand that pain that is accompanied by anxiety is intensified by the brain. Pain that is accompanied by laughter is minimized by the brain. That's a brain function technique. When you're in pain, your brain tries to understand why you're in pain because the pain message is going up your spinal cord. It hits your lower brain. At your lower brain, it goes through what we call the spinal gate that only lets the most important pain message through. But then it goes to the midbrain. And the midbrain establishes context. Is this good pain or bad pain? If you're in pain and you're crying, your brain's going to go, uh-oh, her life is really at stake. I better intensify that pain. And then it sends that pain message up to the upper brain to get you to do something. If you're touching something hot, that's why you pull your hand away. Pain that is accompanied by laughter, your brain goes, well, she's laughing, therefore her life is not under threat. And it goes, okay, this is good pain. This is the pain you get when you're riding a roller coaster and you get thrown against the side of the car. But it's good pain. It's not a bad it's not a bad pain. Your brain minimizes that pain. So anxiety amplifies pain, laughter minimizes pain. One of the underlying drivers of widespread pain is a chronic state of anxiety. A lot of us have PTSD. A lot of us went through childhood trauma. A lot of us were abused as children. And that sets up a brain that is living in a state of fight or flight, often for decades. But we can bring that down now without any shame or without any blame. It's just, how does the child's body process trauma? Puts you into fight or flight. The challenge now is we've got to get you out of flight or flight. And we can do that decades later. We can do that to children now, but we have techniques that can do that now. So again, breaking that perception that this is all in your head, breaking that perception that this is mental illness, it's not. For those of us with widespread pain, it is a trauma response. Okay, and you guys, please, on Facebook, if I missed your question, please, please, please ask it again, because Facebook is jumping all over the place with the messages, and I get through a sentence and then I lose it. See, I just lost another one. Oh, come on. Deirdre says, what's lactoferrin? Lactoferrin is a protein found in milk that is an essential part of our immune system. It has natural antibacterial, antifungal, antiviral effects. And we had a study released last August, which showed that it was stunningly successful with IC patients. If you go on over to the IC Network website, right on the front page, you'll find a blog that goes through that research. Especially for patients with Hunner's lesions, it's very, very good. Pamela said, I do believe when I fell out of a car on my backside, that was what caused it. Honey, that's exactly the type of injury we look for. Oh, Facebook, you're making me crazy right now. My doctor didn't even give me refills of my pyridium. Oh, that's awful. Lori said, I have an IC bladder, just found out I have COVID. Will this affect my bladder? About 75% of IC patients who get COVID will experience a mild to moderate to severe flare because of that COVID. Diane says, how do you find out if you have end-stage bladder? Your doctor will tell you. Deidre says, where do you get the lactoferrin? You can get it from the IC Network website. We have it in our shop. I brought in when that research came out, I looked for a lactoferrin that did not come from the United States. I'm getting our lactoferrin from Australia. I did not want to bring in a domestic milk product because we have such bird flu right now in our dairy supply, that I was very uncomfortable bringing a dairy-based product into the IC Network store where it could be exposed to bird flu. So our lactoferrin comes from Australia. We're importing it directly from Australia, which is why it's a bit more expensive than others. Christine said, my consultant offered me Botox to the bladder. Will that help with tight muscles? Not if it's in the bladder wall. They can do Botox directly into a tight muscle, so it depends on where they put the Botox. But again, Christine, it's about your phenotype. We need to know what phenotype you're in. If you've got super tight pelvic floor muscles, girl, you got to be in physical therapy. And if you don't have a physical therapist near you, then I would encourage you to all right. Where is it? Ah, here we go. It has fallen. All right. So, for anybody struggling with pelvic floor dysfunction, this is the book. Please, I beg of you, get this book. This is our pelvic floor Bible. If you have any history of injury or trauma to your pelvic floor, this is a master class in the pelvic floor. And it starts by teaching you pelvic anatomy, like the bones, the sacrum versus the coccyx, etc. It then teaches you about muscles, your hip rotators, all that sort of stuff. Teaches you, again, these are the muscles from the bottom up of the perineal area. See, there's a lot of muscles down there. You got muscles that wrap around your urethra. You've got muscles that wrap around your vagina. You've got muscles that wrap around your rectum. Those are levator muscles. And when those muscles get tight, what happens? They squeeze the urethra. They squeeze the vagina. They squeeze the rectum. Also, you will see here that there are 3 distinct layers of muscles. We've got the shallowest muscles here. Then we've got mid-level muscles. And then we've got our deeper muscles also. They talk about the nerves. One of the things that we see that's so important, let me see, there was a great picture in here. This section on central sensitization. There's a section on crush injuries, what happens. Look at this. This is important. This is the perineal nerve coming off the sacrum. And you can see it's going right through muscles. You see that? So if this muscle is tight, what is it going to do? It's going to squeeze those nerves. If you got pain when you sit down that gets better when you stand up, the odds are you got a muscle that's squeezing a nerve. Okay, but there was something else in here I wanted. Let me see if I can find this here. So this is the book that really helped me personally understand how I was supposed to work with my muscles. You know, so at some point in time, somebody's going to suggest that you get a wand. Okay? A wand. Let me get my model here. Okay. So here's the thing you have to understand about the muscles. So let us remember our basic anatomy here. Here's the pubic bone, hip bone, um, spinal cord, vertebrae, sacrum. So we turn it around the other way. Here's your vertebrae. Here's your sacrum, which are basically what we call vestigial vertebrae. They fuse together. Underneath that all is your tailbone. Okay? And you will see that muscles go from the left and right of the tailbone. So the tailbone is actually the center of your pelvis. It's the foundation of your pelvis, for lack of a better term. The challenge with muscle injuries like this, and let me tell you, it'd be great if it was a shoulder injury because shoulders are easy to look at. These muscles are deep within our body. They're hard to identify. They're hard to reach. Some patients would just want to do stretching on the outside. It doesn't work that way because when you look at these muscles, you can see that they are on the inside of bones. You can't push through the bone and reach the muscle. The best way to reach the muscle is through the vagina or rectum. And when you have a pelvic floor assessment, the physical therapist will have her finger in here, and all she's going to do is she's going to touch muscle. Is this muscle tight? Is this muscle tight? Is the deeper, the shallower? All she's going to do is touch muscles, and she's looking for pain. She's looking for discomfort. A healthy muscle feels like a raw chicken breast. It's soft, but it has substance. A tight muscle feels like a cooked chicken breast. A very damaged muscle will feel like beef jerky. That's new. That a physical therapist just offered that to me a couple months ago. I think that that's a good explanation. So a physical therapist is going to look just by touch for weird, funky muscle knots, anything going on at the pelvic floor. So hopefully you can get to a physical therapist once just to find out. But you have a chance. I mean, every time you urinate, that gives you an idea of the health of your muscles. If you can pee like a horse, your muscles are good. But if you're stopping and starting, you can't start your urine stream on command, that means your muscles are tight. So at some point in time, somebody will say, hey, why don't you do a wand? This is what I do. This is the exact type of wand that I use. You can get it from desertharvest.com. Okay. So when you use a wand, you're laying on your back, you have your feet up on the wall. You can use a wand and get in here and massage these muscles yourself. It doesn't take that long. And the muscles respond beautifully to therapy. When you just start rubbing them gently, they immediately start to relax and calm down and plop back down into the right position. Okay, so again, no, Carol, your question wasn't removed. It's just, unfortunately, Facebook is being very weird and it's jumping all around and I'm missing questions right now. So just keep asking it again and again until you get an answer from me. Or you can email me, icnetwork@mac.com, and I can look at my email. All right, so hold on. Oh, Facebook, what is wrong with you today? Okay. Okay, so Harriet, I see. Katie, you're welcome to email me, icnetwork@mac.com. We can try to Zoom. We can try to set up a time to Zoom to talk. Just pop me an email, okay? icnetwork@mac.com. Facebook is not cooperating, guys. I'm sorry. I just don't know why it's jumping around like it is. I know I'm missing stuff here. Sharon said, my doctor refused to remove my bladder and told me that some people have phantom pains even when the bladder is removed. That's very true. Melissa, no, that doesn't. She asked if putting a star in there counts. No. Doing a star is like a little mini donation. I think a star might be worth a penny. So you have to set that up in your account. Honestly, I don't know how to do that. Hello, David. Nice to see you, dude. Smart multivitamin. So was my idea. Actually, I'm the person who helped to invent the first low acid vitamin. And it happened while I was talking with the CEO of Far Laboratory. It's an old company that no longer exists. The CEO said, if you could make anything for a patient, IC patient, what would you make? And I said, I know exactly what I'd make. Make a low acid vitamin. So that company created the first acid vitamin called Multi-Right, but the vitamin was just too big and too dry. It's really hard for patients to swallow. I mean, the epitome of a true horse pill. And so I started working with another company, Natural Approach Nutrition, said, can you make us a low acid vitamin that's easier to swallow? And that's Bladder Smart. And Bladder Smart's been one of our best sellers. It's a wonderful low acid vitamin, certainly worth a try. Happy said, natural remedies do work. If they didn't, we wouldn't have used them for thousands of years and pharmaceutical companies wouldn't be studying. Oh, honey, listen, cannot come in here and advertise. Sorry, won't have it. Amy said, I had pelvic floor trigger point injections with lidocaine and Kenalog. I think it's helping, but kind of flared the first couple of days. Yeah, for many patients, their muscles have been tight for a long time because of old injuries. And so it's not at all unusual to have a little bit of pain and discomfort when you start working with those muscles again. Doesn't worry me at all. Just tell your physical therapist about it, and then they can troubleshoot that a little bit more for you. Try to understand why that's happening. Harriet's saying she's meeting with a therapist at her new provider's office. Excellent. I say go for it. Sharon says, how do I feel about the Amelia chair treatment for incontinence? My urologist was concerned that it would cause me pain with my IC and vulvodynia. I had 2 treatments. It has not caused me any discomfort at all. Sharon, I honestly didn't know that they were still doing that. So there is, so years ago, here, hold on a sec. It's Emcella. Hold on. Okay. So years and years ago, somebody thought, hey, wouldn't it be nice if you could just sit in a chair and get some pelvic floor relief and therapy? Hey, it makes sense, right? I mean, talk about an easy way out. You just sit in your clothes on a chair. How would that help? Well, it's been under a couple of brand names, but the brand name now is called Emcella, Emsella, and it is for urinary incontinence, often caused by weak pelvic floor muscles, nerve damage, bladder dysfunction. It's an FDA-approved therapy that offers a non-invasive solution for strengthening muscles and restoring bladder control. Receiving treatment is as simple as sitting on a chair. Patients sit fully clothed on a specially designed seat that uses high-intensity, focused electromagnetic therapy to deliver pulses that stimulate the pelvic floor muscles. Over the 28-minute session, thousands of contractions are produced in the pelvic floor that are more intense than those achieved with pelvic exercises. This course of treatment helps to strengthen muscles and restore support for the bladder and urethra. It can also reduce episodes of incontinence and improve bladder control. Okay, so the reason why this would not be appropriate for most IC patients is because most IC patients have tight muscles. And the last thing we want to do is do something that will cause more bladder contraction. But if you struggle with incontinence and you have weak muscles, power to you, girl. Sounds like a good idea. Renee says the vagus nerve going into permanent on, this causes anxiety. Harriet says, what does hypertonic pelvic floor mean? It means that your muscles are very, very tight. Hypertonic. Hypotonic is weak, hyper is tight. David says, does polyoma cause Hunner's lesions? Yes. That research came out years ago that the polyoma BK and the polyoma JC virus was found in the urine of patients with Hunner's lesions, along with the Epstein-Barr virus. Lori says, can you take lactoferrin every day? I have COVID. Will this help with the flare? Lactoferrin literally comes from milk. If you can drink milk every day, you should be able to take lactoferrin every day. The question is, do you need to? A lot of people would love to sell you stuff and say, hey, take it every day. But the research that we have is 4 months. So is there any reason to go beyond 4 months? I don't know. It depends on how your bladder responds. Would it help with COVID? There is some research with lactoferrin and COVID. I know I saw it. Let me see if I can find it. Lactoferrin binds ACE2, the host receptor for the SARS-CoV-2 virus. This process hinders the attachment of SARS-CoV-2 spike protein. This direct inhibition of the virus by lactoferrin involves multiple mechanisms. Okay, that's from the University of Florida. Here's a study with lactoferrin and long COVID. Lots of research on it. And then there's one study from the National Institutes of Health. Did lactoferrin help hospitalize patients with severe COVID? They say lactoferrin showed an excellent safety and tolerability profile. And even though it is safe and tolerable, the results do not support its use in hospitalized patients with moderate to severe COVID. So just Google lactoferrin COVID. Lori says, what are my thoughts on Botox? I have had bladder looked at by my urologist. Bladder shows red walls and inflammation. Taking a bladder installation, which can help so much with the spasms, but I wake up with a sore bladder all the time. Once I'm up, the bladder is better. I know the installations are helping because I was good and it's been 2 months and I'm due for one this week. It's starting to flare. Well, Botox turns nerves off, so Botox will help to reduce frequency urgency if they get the right nerves. They can accidentally silence the nerve that controls your ability to pee, which then means that you might need to self-catheterize. Lori, I would be far more tempted to try the lactoferrin than the Botox to start with. Shelley says, I'm not sure how to phenotype myself. I think I have multifaceted causatus. I have very tight pelvic floor muscles. I'm in the top 10% worst cases my specialist has ever treated. I also had a full hysterectomy at 25 years of age. I'm now 55, and you have a shrinking bladder and estrogen atrophy. How do I determine my phenotype? Honey, you can just kind of phenotype yourself. You know, number one, you have very tight pelvic floor muscles, so we know you're pelvic floor driven, and you've been in estrogen atrophy for 30 years since your hysterectomy. So your phenotype, your easy early phenotype is pelvic floor driven, along with genitourinary syndrome of menopause. The question is, do you have Hunner's lesions? If you have Hunner's lesions, that puts you in that phenotype. If you have widespread pain, then that also puts you in that phenotype. But you're always welcome to give me a phone call. I'd be happy to talk with you. Carol says she missed my email address. It's easy. icnetwork@mac.com, short for Macintosh Computer. Okay, so Amy said you had Botox into the vaginal wall, sore left rectum, and tailbone pain. Interesting. Debbie says she feels like I'm constantly getting into spasms. So Debbie, the question is, what kind of spasms? Are they bladder wall spasms or pelvic floor spasms? Do the spasms happen as you're urinating, or do you feel a vibration? Debbie said, "Has anybody done InterStim?" Lots and lots of people have done InterStim. Um, I've been doing because I ran the support group here in California where InterStim was developed. I've worked with InterStim patients for 30 years. InterStim has uses neuromodulation to try to re-regulate the nerves, but it has a really high risk factor. There are many, many, many potential adverse events associated with InterStim, including MRSA infections, um, device malfunction, devices moving. I know doctors love to promote it, but when you actually look at the data and you look at the reports with InterStim, just there are a lot of side effects. There's another form of neuromodulation called axonics that does not have that same risk profile. And so if you come on over to the IC Network website, you can read about sacral neuromodulation. Axonics is new. I don't have a lot on axonics on our website right now. Um, but the safety profile for axonics is clearly much less risky than the safety profile for InterStim, and yet they do the same thing. And I'd be happy to I have a huge section on InterStim on our website, as well as questions you need to ask your doctor if you're considering InterStim. I show you how to research the adverse events. And really the most important thing about InterStim is, again, your phenotype. We need to understand what your underlying phenotype is, because InterStim's not going to help Hunner's lesions. InterStim is not going to help widespread pain. InterStim is really kind of ideal for patients who have a nerve dysfunction that's causing them frequency urgency syndrome. Um, um, Most importantly, do not agree to do it until you get in writing from your insurance company, in writing in your hand or in your email box. Make sure they tell you it is pre-approved, because we have had patients who have been told it's pre-approved, it's been pre-approved, and then they have the surgery, and then a week later they get a bill for $75,000. So do not have any of that done until you have in writing. Don't just accept a verbal. It has to be in writing. This is approved by your health insurance company. Otherwise, you absolutely could end up with a five-figure bill, and that's devastating. Gay said she has the axonics. Cool. That's great. And Gay, you like it, right? Beverly said, what was the other treatment besides Botox that you were mentioning? Well, we have a lot of potential treatments. I'm not sure which one. I mean, but today we don't just throw bladder treatments at you. Today we phenotype you first, because we want to understand what your underlying phenotype is. It's impossible to pick the right treatment for you until we know what your underlying problem is. And the way we do that is with phenotyping. We have to figure out which group of patients you fit into, so that we can talk about the correct treatments for that group, because each group has different treatments. So Hunner's lesion patients have one set of treatments. Estrogen atrophy patients have one set of treatments. Chemocystitis patients have one set of treatments. Pelvic floor patients have a different set of treatments. Widespread pain. So we have to figure out what group you're in first to try to find what could be the best treatments for your unique case. Julie says, I'm getting Kenalog injections 3 to 4 years now. It used to last 6 to 8 months pain. It seems now it's 4 to 5 months. I'm listening to your suggestions. I think I'll even leave the decaf coffee. Yeah, so Julie, the thing here is that the Kenalog injections are what I call, they're not, because your symptoms come back. They might be easing some of the symptoms. Kenalog is a steroid reducing inflammation in your bladder, and that's why you might be feeling better with it. Um, um, I would be, since you've responded to an anti-inflammatory, why not try another anti-inflammatory like lactoferrin? That would be an interesting experiment. Darla says, is lactoferrin lactose free? Yes. The company told me it is lactose free. Patients who are lactose intolerant do not have, there's not enough lactose in it to trigger a reaction. Debbie said, I feel like the spasms are coming from my urethra after urinating. Liquid fire. I feel it low in my vagina. So, so Debbie, does your urine feel hot, like it's coming out, like it's burning you? Gay says she loves the axonics. And you guys, YouTube guys, I'm trying not to ignore you. I'm really not. Mary said, are we still able to speak with you? Yes, of course you can. So hold on a sec. Let me scroll back up here on YouTube here. Sneaky says, my gynecologist prescribed me gabapentin, and I'm assuming it's to see if it's nerve related. I'm so scared to take it though. I think I'm going to ask for a pelvic floor exam next time I go. Yeah, the pelvic floor exam should have been done before giving you therapies, because the pelvic floor exam helps to identify what your underlying problem is. So if you're worried about the side effects of Neurontin, you can slow back. I mean, you can back away from that a little bit and say, hey, doc, before you give me a med, which has the potential of giving me really severe side effects, I would really like for you to do a pelvic floor assessment. Let's just make sure that we're not missing something very common here, which is very, very tight pelvic floor muscle. Because we want you to put your money into the therapy that has the best chance of helping you, right? Sneaky says she'd love to do a call with me. Is there a way of setting something up? So the way I work in my office is I take phone calls every day. First come, first serve, except for Mondays, because Mondays are my day off. So you can call Tuesday through Friday. You can even call on a weekend. Every now and then I pick up the phone there. I always have a little angel on my shoulder who tells me when to pick up the phone on the weekends, because, you know, every now and then there's like somebody last night really needed me. So I answer the phone. Um, so it's first come, first serve. And for a quick call, 5 to 10 minutes, 15 minutes, not a problem at all. But if you want to spend a lot of time talking about your case, 30 minutes or longer, I would ask that you sign up for a coaching session in the IC Network shop. Patients who sign up for coaching always get first dibs. All the others, I take you as you call. Sometimes I call back late. Sometimes it might take a couple of days for me to call you back, but I do try to call everybody back. I would just encourage you to be a squeaky wheel. If you don't hear from me right away, please don't hesitate to call again. It's just understand that we're really, I mean, the phones are hopping every day. And some days I'm on the phone for 8, 9 hours straight. And so just be patient. Also know that because I'm in California, I return phone calls late. So it might be 5 o'clock here, it might be 8 o'clock there, but I do a lot of my phone call returns later in the afternoon here. So I just need you to understand that I would love to just be free for everybody all the time. But, I have bills to pay too, and I hope that you see some value in talking with me, and so I always end up those conversations with, "If you found this conversation helpful, please think about becoming a member of the IC network or buying something in the IC network shop or make a donation." I never go back and look. I just try to plant that seed, but just understand that the only reason I can answer the phone is because we have members who basically help me pay the bills. Okay. And it's not going to cost $2,000. It's literally $50 for 30 minutes. And then you can call me back and not have to pay again. And guys, like 98% of the calls I do are free. So just understand that. Diane says, I'm having a hard time giving up my one decaf coffee with pre-leaf and a little dark chocolate. I have estrogen atrophy, so I know I need to heal my bladder. I just feel depressed giving them up. Well, honey, why don't you try Dandy Blend? Try the herbal coffee. The herbal coffee is fantastic. And you can make fraps with it. You can make lattes with it. It tastes so good. But, I mean, it's always interesting because there are some patients who they're like, I'm not stopping my coffee. It is a part of my identity. I love it. I need it. And they're the ones who suffer the most because that one cup of coffee a day does profound damage to your bladder's ability to heal itself. And then there are other patients like me. It's like, hey, I was in such agony, I'd give up anything. It's like, give a coffee, yeah, not a problem. Because I don't want to live with that pain. I didn't want to live with that pain. And now, ironically, I have been, I had my gallbladder removed last March, and then 2 months later, I was diagnosed with breast cancer. So then I had a double mastectomy. So I've had two major surgeries in the last 10 months, and I really struggle eating fats. I cannot eat fats right now. I made the catastrophic mistake of um, I went and had a blood test, stopped on the way home, and got a frozen yogurt, low fat frozen yogurt. And I had the worst diarrhea for hours. This was like 2 weeks ago. For hours. Like, oh my God. And that's what we call a bile dump. Because when you don't have a gallbladder anymore, when you eat fat, your liver releases bile. The bile goes right into your bowel where it acts to cause diarrhea. And I had been struggling off and on with that since, for the last 10 months since I had my gallbladder removed. And finally, it was just so bad. I went, all right, I'm done. And I started reading more about, because knowledge is power, reading more about bile dumps and how do you how do you deal with losing your gallbladder. And they said no dairy. Well, I was eating no fat dairy, or low fat dairy, but that's gone now. And what's amazing is, and I'm doing a very extensive elimination diet. Man, I am tracking every damn thing I'm eating and putting in my mouth. Because you know, you can't leave your home when you're having a bile dump. You barely make it to the bathroom, and you're thankful that you're wearing mini pads sometimes. So doing that diary is really, really important. So anyway, the point that I'm trying to make is, if a food is causing you distress, if a food is causing symptoms, let it go. Letting go of the yogurt, very easy for me. And it's amazing how much better I am. The other thing that I learned that I didn't know is that soluble fiber absorbs bile. So for anybody who's had their gallbladder removed, it's really important that you do more fiber because fiber absorbs bile. So if I started the day with like Kick cereal, which was like the only cereal I ever eat every now and then, I will absolutely be in the bathroom. But if I start the day with Ezekiel bread, like I did this morning, we're good. Cherry says this bile dump sounds like what I have. Oh, it's so annoying. Sharon said you need to take ox bile. What is that? Because there's nothing worse than having to stay. Ox bile is on Amazon. What is that? Nutricology ox bile 500. I don't have a bile deficiency. I have a bile overabundance. Huh. Well, I'll have to look at that a little bit more. So annoying. Okay. So Diane, you can do it. Let the coffee go. Try Dandy Blend. And she says, I'll do it for a day or two. My bladder won't feel better and sometimes worse and go back to them. Then I think I'm addicted to the dopamine release from them. Yeah. You know, ironically, I started this meeting talking about the California fires, and every time I've evacuated, especially for the two really big fires where we lost thousands and thousands of homes, um, Starbucks Frappuccinos were my safe place. Wherever I was evacuated to, I would go find a Starbucks and get a Frappuccino. And I'd be evacuated with my best friend, and we just drive down to Starbucks and we just, phew. And remember, because my phenotype's pelvic floor, widespread pain, I could do a Starbucks Frappuccino. But eventually, my heart became very intolerant to any coffee. I can't do any coffee right now. But I totally understand the whole Starbucks routine. If I could go back and do that, I would go back and do that. Starbucks Frappuccinos in a hot summer day is a win. But unfortunately, I have a redhead heart and it doesn't want anything with caffeine in it. Anything. Otherwise, I'll have tachycardia and it'll scare the living daylights out of me. Mary said, I lost my urologist, said there's nothing he can do for me no longer and don't know what to do next. Yeah, call me. Let's try to phenotype you. Zara says, I'm so lost on this journey. It's been 4 years of endless suffering. The food I can eat is getting shorter by the day. So I really need your help. I will call you tomorrow. Call me on Tuesday, honey. Mondays are my day off. Or if you do want to try to call tomorrow, call later in the day. I might answer the phone later in the day. Mary says, my internet's acting up. You keep going in and out. I can't make out what you're saying. Sorry, honey. Diane said, I tried Dandy Blend, but I feel so bloated. I think it's from my IBS, which is from SIBO. Interesting. Okay. So then how about a rooibos tea? Here, let me go get it. Hold on. Okay, so here's the Dandy Blend. And it's just an instant coffee, herbal coffee that you dissolve in water. And then my favorite herbal tea is this Harney and Sons pumpkin spice rooibos tea. But it's not pumpkiny at all. It's more like a caramel. And it comes in little silk containers. And so if I want kind of a cup of something that's just like really, it's that after dinner signal that the day is ending and you can just take a chill and just relax. Um, Harney and Sons pumpkin spice is fabulous. Absolutely fabulous. All right. Let's get back to Harriet here on Facebook here for a moment. She said, it's gasoline on fire. I had to give up coffee, soda, and citrus. So, Harriet, anytime we start feeling hot urine, that's estrogen atrophy. That's usually estrogen atrophy in your urethra and on your vulva. Like if it feels like you're being burned as urine's coming out, that's what that tells us is that your skin is very dry. You don't have that nice thick protective coating that normally protects it because you're in estrogen atrophy. And the treatment for that is, in fact, topical estrogen. When you give that skin estrogen, it immediately plumps up and starts to produce that moisture, that mucus that protects that tissue. So that we call that urine burn, where your urine feels very, very hot. That again, that's usually just estrogen atrophy. Diane said, "Is the T in the IC network shop?" Yeah, should be. Zara says, "Is this a clue of my muscles and my pelvis being here?" Hold on. She said, "Whenever I have a bowel movement or feel like I'm going to have a bowel movement, I get relief from my IC pain." Huh. So I guess a couple of things come to mind. Um, we've long known that being constipated will make IC worse. And it's really about proximity. And I don't know if I can. Here, hold on. Oh, my sign going to turn on? It turned on for a moment. Okay. So let me see if I can demonstrate this a little bit. So here we go. Pelvic cavity. This is a small confined space, my friend. There's a lot happening in the pelvic cavity, especially in women. So the first thing we're going to put in is, let's go ahead and, oh wait, okay, hold on. I got to get this. Okay. So here we go, pelvic cavity. So we're going to put in the vagina and uterus, right? Then we're going to put in the rectum, which is going to go like right there. Okay. So look at how close those are. And then we're going to put in the bladder. See that? You see that, my friends? So if you happen to have a lot of stuff in your rectum, that's going to push against things. And so we've long known that there are episodes that in periods of constipation that can cause bladder pain and discomfort. And of course, the other thing we know is that when the nerves in the bowel get irritated, so do the nerves in the bladder. So that's also well known. And then, not to be disgusting, but we got to be real. Sometimes what happens to some patients is something that we call packing. And that is where stool collects in the rectum. You might not feel it, but before you know it, you've got a bunch of stuff hanging out in your rectum. And then finally, at one point in time, you go, "Oh, I think I need to go to the bathroom." But there's like so much in there that it's actually kind of hard to have a bowel movement because generally people who are packing have little hard, dry poops. And so they all collect and it becomes a challenge. And that there can be a sizable mass in there that really pushes against the bladder. And so this is why it's really, really important that we work on having really good bowel habits, making sure we're drinking enough water, making sure that we're eating enough fiber so that that does not happen. But I've had that happen to me many times over the years, and most people have had that happen to them at some point in time from periods of just not drinking enough water. So that's one reason why I think having a bowel movement would make your symptoms get better. There's probably some reflex nerve pathways, but don't ask me what they are. Maybe you're just super, super relaxed. Your pelvic floor is going out of tension. I mean, because, like, honestly, there's like nothing better than starting the morning with a really good poop, and then your day goes on, and it's like, woo, it's over, it's done. I mean, that's true. That's just the truth. Is there any other reason why having a bowel movement would make your IC symptoms go away? I can't think of any others. Hmm. Interesting. Very, very interesting. Okay, hold on. Where am I? So I would, at a minimum, want you to have a pelvic floor assessment, Zara. Let's see if there's anything going on with your muscles that's contributing to that. Diane said, I've had the same thing happen when I feel like I'm going to have a bowel movement. I have relief of IC pain. It's like the sensation of urge overrides the bladder pain. That's interesting. Hmm. Hadn't thought of it. Hadn't thought of it that way. Claire said, has anybody had stem cells therapy for their IC? Stem cell therapy was originated for IC out here at the California Stem Cell Center by Dr. Elliot Lander. They did something called what was this was years ago. This was like 15 years ago. They harvested fat. So they did a liposuction, got a good chunk of your own fat, then they processed it to isolate the stem cells, and they ended up with something called stromal vascular faction, which are basically a collection of stem cells found in fat, and then they gave it back to you. Um, and the results were encouraging, but not durable. So in other words, and this was self-funded IC research. It was like 6,000 a pop, and 6,000 to have everything done and the stem cells harvested and created. Um, his own research found that it did not provide long-term success. So stem cell therapy has now we've had more studies from Asia and from China. They have taken stem cells from umbilical cords of infants, and they've gotten interesting results with that. But that's very controversial. I don't have any stem cell study that has knocked my socks off. Not like the lactoferrin study, which knocked all of my clothes off. It was just so exciting to see a study show such success for IC. Denise said, no more bladder pain, but I still get spells of vulva burning and I use my hormone cream, but it still happens. Well, honey, it's going to happen because you're older. I mean, that's what happens with estrogen atrophy is as we get older, our estrogen levels just continue to drop. And so that's not at all surprising. That just means that your skin is compromised from aging, so keep using your estrogen cream. Harriet says, yes, she started her estrogen cream. Excellent. The cream could take a couple of months to show improvement. That's true. And Harriet, you guys never give up on estrogen cream if it makes you burn. First couple of times you use your estrogen cream, there's a very good chance you might feel a burning sensation from it. That's normal. That means your skin is very dry, but you have to ride through that. Every time you use your estrogen cream, your skin produces more mucus and things get better. So stay on the estrogen cream if you can. Denise said she's been using it for years. I have too. Lori said, so lactoferrin is good to take when you have COVID. Well, there are quite a few studies out there that look like it might be helpful, although there's one study that says if you have very severe COVID, it was not found to be helpful. It's kind of a no-brainer though, because there's extremely well tolerated. It comes from milk. It boosts your immune system. It prevents viral infections from growing. And so is it worth trying? I think it is, but you've got to look at the research yourself and see what you think. Susan said, are Kegel exercises okay to do with IC? Susan, the question is wrong. Your question is, are Kegel exercises okay to do if you have tight pelvic floor muscles? And the answer is no, they're not. They are specifically in all of our guidelines, they do not do Kegel exercises if you have tight pelvic floor muscles. The purpose of a Kegel is to tighten a weak muscle. But if you're doing a Kegel and you have tight muscles already, you're just going to make your pelvic floor dysfunction worse. All right, you guys are hopping on YouTube here. Diane said, let's see. Zara says, I think so too, but I just don't know what to do about it. And she's the one who, after she has a bowel movement, her icy pain feels better. Zara, we can dive into that research a little bit more. Have you done some reading on it? Because you're the first who's ever said that, like in 30 years. I think that's interesting. So I'm sorry I'm not on top of that, but I've never heard a patient say that having a bowel movement made their IC symptoms better, unless they're constipated, and then we know it does. Diane said, I had relief from the post-tibial nerve stimulation, but it only lasts a couple weeks and maintenance is monthly treatments. Okay, but at least the post-tibial nerve stimulation is much less risky than InterStim. I mean, I did it myself, and I did it for a couple of years, and I really believe that it helped me out of a very severe flare. Zara, I guess the other question that I would ask you, since we're trying to calm these nerves down, is have you tried Peora yet, the palmitoyl ethanolamide? Because PEA acts to calm nerves down. That's what I take every night. That's in the IC Network shop. You can look at the research. The research on that's very good with IC. 87% of IC patients who tried it reported a significant reduction in their pain and discomfort. Diane said, I'm considering sacral neuromodulation, my Euro. I've had for 2 years implants, InterStim, and Exonics. I think I would be looking at Exonics before I would look at InterStim. Zara says, can I get PEA delivered to the UK? Zara, in the IC Network shop down at the bottom, I have a link to our Amazon UK page where I found similar products that you can get through Amazon UK. And so check that, because I think I have a PEA in there from a different company, but that's okay. Okie dokie, artichoke. Now, I know on Facebook, guys, Facebook just jumping all over the place. Hold on. Sharon said, I'm scheduled for an HFX spinal stimulator by Nervo. My doctor said it if it works, I won't have any pain from my belly button down. He said it would help my IC and vulvodynia. I'm very hopeful. An HFX spinal stimulator by Nervo? I've never heard of Nervo. And you guys, again, on Facebook, it's been really weird today. If you've asked a question and I missed it, then please don't take that personally. Just ask it again. No, it's Nevro. It's not Nervo, it's Nevro, Nevro. So it looks like it was approved for we call it a chronic pain solution. For painful diabetic neuropathy and non-surgical back pain. Oh, I don't see any mention of pelvic pain or bladder symptoms. Huh. Hold on. Hmm. Hold on a sec. This is interesting. So it uses a Bluetooth wireless connection to connect the device to the implant. So, okay. So, Sharon, let us go to the FDA's MAUD database, which is the database where all medical device complaints are stored. And let's see if we can. The manufacturer is Nevro. Let's see if they have what adverse events from December might have been. Let's see, 68 adverse events on the Sensa device. All right, let's look at these. Injury. The manufacturing and sterilization records were reviewed and no nonconformities. Okay, here. Okay, hold on. It was reported that the patient experienced a wound infection at the implant site with the device reportedly coming out of the patient's body. A medical assessment from the physician regarding the nature of the report was not available. The patient was hospitalized and underwent a removal of the device. All right, that's the first one. Let's look at the second one. That was filed on December 31st. The next one is also an injury. It was reported that during an explant procedure, the physician inadvertently cut the lead above the anchor. This caused the lead to retract to a depth that made retrieval unsafe. Consequently, a fragment of the lead was left in the patient. Yikes, that's not good. Let's go to the third one. Injury. Patient acquired an infection at the pocket and lead incision site. Patient was hospitalized, received oral and IV antibiotics, underwent a wound washout, and had the device removed. And next one, injury. Another infection. Let's see. Here's another one. They got a staph infection. Device was explanted. Just like InterStim. Here's another one. Injury from an infection. Here's another one. Infection. There's another one was removed, but they left the leads inside. Here's a hypersensitivity allergic impaired healing. Patient experienced a wound issue. The doctor believes the patient had an allergy to something the battery was made of. The patient had the device explanted. There have been no further reports of complication. Here's one. It was reported that the patient experienced a loss of sensation on the top of the head since procedure. Healthcare provider assessment regarding the cause. The reported event was not available. That doesn't make sense. So not as many adverse events as InterStim, but that might just be because, but they're the same adverse event. Here's somebody at swelling and fever. Here's a patient said the Nevro site always hurt them because they had a foreign body implanted there. Anyway, so Sharon, don't assume that it's less risky than InterStim. And if you want to read those yourself, just Google MAUDE database, like the old TV show MAUDE, MAUDE. Debbie says, does cystocele irritate IC? Absolutely. And again, you guys on Facebook, please just understand that it's being weird. Somebody asked where my phenotype protocol is on the IC Network website. I have extensive information on phenotyping and also in our book, IC 101. Sharon says, my doctor specializes in this implant. Yeah, that's fine, honey. But you got to understand that, I mean, there are a lot of doctors that specialize in neuromodulation. The question is, what are their rates of adverse events? You can't walk into that and assume that every patient is fine. I mean, we've been working with neuromodulation patients for 30 years. And the harsh reality is that putting something foreign in the body can cause side effects. And the number one side effect, as you read, as I read to you, and I will show you how to do your own research, is infection. That's a problem with all of them, except axonics. Axonics doesn't appear to have the same rate of infection. And then we have issues with devices moving. So we as patients have to be knowledgeable about what those risks are so that we're not blindsided. And so what I would do is I would read our section on our website about InterStim, and there's really good questions in there. And then I would ask your doctor those questions about the Nevro device. Like, what kind of adverse events have you seen? Were you able to successfully resolve them? How many patients have had to have their devices removed? Is this covered by my insurance? One fascinating thing that I find absolutely stunning is that some insurance companies will not pay to have it removed. So let's just say it stops working. Well, okay, if it stopped working, don't you want it out of your body? Well, most patients would want it out of their body, but there are some insurance companies that refuse to pay for it to be removed, and the only time they'll pay for it to be removed is if you're having a complication from it. And the longer you leave a device in your body, the more scar tissue grows around it, the harder it is to remove. So, that's one of the reasons why I didn't have breast reconstruction is I didn't want to have implants because I just honestly didn't want to have foreign bodies put something else foreign put in my body. So you just have to be educated about this because lots of doctors specialize in this, but that doesn't mean that they haven't experienced random or frequent adverse events from doing it. Lori says, "Can I take bladder builder every day?" Yeah, that's why it was created. I think that, but the question is, we don't want you to take a supplement for the rest of your life. At some point in time, 6 months down the line or a year down the line, the question then becomes, is the supplement helping? And the way you figure out if a supplement is helping is you just back off the dose. So if you're taking 4 a day, go down to 3 a day. See if your symptoms get worse, maybe it's helping. If your symptoms don't get worse, back down to 2, back down to 1. Because it's not about enriching the pockets of companies as much as it is about finding what works for you. I have a real hard time with companies that say you're going to be on this for the rest of your life, especially for supplements, because that's a great way to make a supplement company very, very successful. But what do our national IC guidelines say? Our national IC guidelines say if you're not responding to therapy, if you're getting worse rather than better, stop, discontinue what you're doing, take a step back, revisit the diagnosis. There's some patients out there who just add supplement after supplement after supplement, and before you know it, they're taking $500 worth of supplements a day. And then they call. I had one patient like 2 weeks ago who was doing this, and then she said, "What else can I take?" And I went, "Nothing. Stop for a moment because everything you're doing right now is not working. So let's see if we can figure out why based upon figuring out what your phenotype was." And in her case, she was pelvic floor driven and she was widespread pain driven. None of the bladder supplements she was taking made sense. None of them. And yet she kept, even when we were ending up the conversation, she's like, "But is there anything else I can take?" And I was like, "Yes, physical therapy. That's where you pay to put your money. You have tight pelvic floor muscles. Stop with the bladder supplements and put it into where we know your fundamental problem is, which is very, very tight pelvic floor muscle." Sabra says, "My urologist said he's going to do a laser if needed during my cystoscopy. Is this safe? He didn't really explain the pros and cons versus a regular cystoscopy." Well, they really only do the laser therapy if you have Hunner's lesions and they just want to close the lesion on your bladder. I think you should definitely ask him what he intends to laser. That's important. Anne says, "What are my thoughts on oxalates with food and IC?" Oxalates definitely irritate some patients, not all. We know oxalates can irritate vulvodynia. That was work done by Dr. Clive Solomon 20 years ago. And so, if removing foods that are high in oxalates make you feel better, what do you have to lose? So, foods high in oxalates are going to be spinach, chocolate, and berries. And so my mom was very, very oxalate sensitive. And once we cut oxalates out of her diet, she did much, much better. I, on the other hand, am not oxalate sensitive at all. Anna says, have I ever heard of a company that does physiotherapy online called Sword Health? I saw a documentary on this company. One of their strongest strands is precisely the pelvic floor. They're mainly in the US market. I tried to contact them so far, but unable to overcome the barrier related to health insurance. Well, honey, you can't do pelvic floor physical therapy online because pelvic floor physical therapy requires a finger in your vagina working on muscle. I mean, and most importantly, that pelvic floor assessment is critically important. You cannot do that online because you need to have fingers touching your muscles to figure out which muscle group is the problem. So, and what our research shows is hands-on myofascial physical therapy is stunningly successful. The most successful IC treatment ever studied is hands-on physical therapy, traditional therapy. So I do not get the whole online pelvic floor physical therapy. That doesn't make any sense to me. Let me go to their website though. Thrive Pairs. Hold on. Best in class digital physical therapy from the comfort of your home. Expert pelvic care supporting you through every life stage. Global access to pain fighting exercises. Highest quality physical health education. So basically, you're working with a therapist on some exercises. I mean, I can see if you have a hip injury or an SI injury, this makes total sense. But if you've got pelvic floor dysfunction from hypertonic pelvic floor muscles, this doesn't make sense to me. Thrive pairs doctors of physical therapy with real-time feedback from our AI, artificial intelligence care specialist. Thank you. No, to offer members all the benefits of in-clinic physical therapy without the hassle. I mean, I can see this helpful for incontinence, where we know what we're dealing with. We're dealing with weak muscles, so we would tighten them, and they give you a biofeedback device. Yeah, it looks like their market is really incontinence patients. But I'm not a fan of biofeedback. It's the hands-on work that's the most successful, in my opinion. And that's what the research shows. Yeah, interesting. You know what? Hold on, guys. I always have to, this time of year, the sun is very, very bright coming in this window. And so I have to put paper on the windows. But now that the sun's moved, it's getting dark. So, anyway. Now, I always make this offer. If anybody wants to go into Zoom to talk one on one, I'm happy to do that. We've been going for about 2.5 hours. As long as you have questions, I'm happy to answer your questions and give you my best insight. So what am I working on right now? I right now am we're working on our winter magazine, the IC Optimist magazine. Um, our lead story obviously is going to be the Elmeron pigmentary maculopathy progression story. I'm planning on doing a couple of articles that I haven't written yet that I'll be writing this week on. I know one is on the inflammatory effects of sugar in the IC diet and why it's important to consider reducing sugar. Um, I am not sure. You know what? Let's just take a look here for a moment. Let me. Sometimes I feel like I'm running like a chicken with their head cut off, and I get distracted so easily. Let's just take a look and see if anything new has come out in the last month. Ooh, I like this one. The anti-inflammatory effect of sea buckthorn in and induced cystitis rat. Ooh, I do like that study. Sea buckthorn is actually an ingredient in uh, vulva balm. So sea buckthorn is an oil that has really good kind of healing properties to it. So this is the first time I've ever seen a sea buckthorn IC study that sea buckthorn exhibited anti-inflammatory effects comparable to those of pentose and polysulfate. Okay, wait. Why would they compare themselves to Elmeron? Hold on a second. Okay, although the mechanism underlying IC remains unclear, oxidative stress is suggested to be implicated in IC development. Sea buckthorn contains several compounds with antioxidant properties. In addition, the intravesical application, oh, so they hurt rat bladders by putting hydrochloric acid in the rat bladder, which is terrible. The So they damage rat bladders and they put sea buckthorn in to see what happened. Ah, that's exactly why I gave up my career in pharmacology because animal research makes me crazy. But the concept of sea buckthorn is cool. So can they put sea buckthorn in a bladder installation for IC? That's really interesting. Okay. Ooh, we have a study from this month. Holy crap, what is this study? Oh, can I just give a big F you? I'm not even going to talk about this study. This is ridiculous. Here's a new treatment exploring the therapeutic potential of something called PACAP, the new Hunner's lesion therapy. Okay, not very exciting. So we had a group of gynecologists at the International Urogynecology Association and the American Urogynecology Society who believe that the correct name for IC should be female bladder pain syndrome, which I'm sorry, I believe it's very disrespectful to men who have. So what are they going to do? They're going to call women with IC female bladder syndrome and men male bladder pain syndrome. Ah, that's annoying. Um, Here's a study about meditation and yoga. Actually, this is it was published this month. It was done at the University of New Mexico. Cool, that's great. So we at the IC Network participated in this study. Um, 97 patients, 49 were in the Mind Body Medicine group, 48 in control. The mind body group had a 72% improvement in their symptoms compared to the control. And the mind body group required less treatments than the control. Yeah, that's cool. That's a good study. I'll have to definitely talk about that. Oh my God. Okay. I can't. Damn it. I'm going to criticize the study, but there's no, I'm not going to talk about that study. See if there's anything else interesting here. MAP Research Network, our big national IC research team, released a study on the relationship of sex. 356 men, 605 women from 6 sites across the USA. Men diagnosed with IC had the most severe symptoms, followed by women with IC, then men with chronic prostatitis only. While men and women showed similar patterns of symptoms across most of the variables, women had increased widespread non pelvic pain, greater pelvic floor tenderness, and higher self reported sensory sensitivity compared to men. About 60% of men diagnosed with chronic prostatitis only reported bladder symptoms of painful bladder filling. Okay. Let's see if anything else pops off the page. The evil twins of chronic pelvic pain, IC and endometriosis. And here's a study from UCLA, and Italy, France, Israel, that found roughly 15% of patients who used Elmeron developed eye disease and inflammatory bowel disease. The challenge here is we got dueling factions. I mean, we've got the people who say Pentosan causes eye damage, and then you've got the manufacturer who says, well, maybe eye disease is part of IC. And it's like, if that were the case, then why would the symptoms improve after stopping the medication, like with the bowel issues? All right, what's happening here? Sharon wants to know where I'm looking at the studies. The National Library of Medicine, pubmed.gov, like publication medicine, med.gov. Leanna said, I was diagnosed with IC and Hunner, excruciating, but there is hope. What are my thoughts on lactoferrin? I'm very, very excited about lactoferrin. Red inflamed bladders with Hunner's lesions healed and became pink and healthy after 4 months of lactoferrin. And that was a study from Europe. The same research team 2 years ago found that lactoferrin was successful at preventing recurring UTIs from E. coli infections. So lactoferrin is a natural antibacterial, antifungal, antiviral. It's an essential part of our immune system. The IC study was fantastic. 31 patients in the study who took it roughly 4 months. They all had a history of IC. What made the study exceptional was that they didn't just measure symptoms, they measured inflammatory markers with bloodstream testing. And they looked at the bladder before and after treatment. And 28 out of 31 after the study had no symptoms, they had no flares. Their inflammatory markers had reduced dramatically, but most importantly, their red inflamed bladders had become pink and healthy. 28 out of 31. And so it is, yeah, it is a critical part of our own our own system as an anti-inflammatory. You find it in your tears, you find it in your vaginal fluid and your seminal fluid if you're a guy. They are a frontline defense of our immune system. They act by preventing bacteria, virus, and fungus from growing. And so um, there's lactoferrin studies for all sorts of different conditions. Because it comes from milk, it's not a synthetically manufactured drug. It is not associated with any great side effects at all. If you can drink milk, the odds are you'll be able to tolerate lactoferrin. The only side effect that's associated with lactoferrin for some people is loose bowel, because it can get in there and start changing your biome because it's an antifungal, so and antibacterial. So I was telling the story earlier. I was working with a patient with severe Hunner's lesions, very severe Hunner's lesions. Not She's not responded to any therapies. She was contemplating making a trip to Europe for assisted suicide. And then she heard, I mean, and that's very tragic and very rare. She just had no success. Nothing, nobody was helping her. All the treatments they did, all the, lasering her bladder, all that sort of stuff, nothing worked. And she was just in terrible, terrible pain. So she was having very, very dark thoughts. And then she attended one of these meetings, heard me talk about lactoferrin, and said, "What the hell? What do I have to lose?" 2 months later, she's 70% better, and she's stunned. And I talked with her on Friday. She's stunned. And she canceled her plans, and she's riding the lactoferrin train right now. And I'm really, really happy for her. So um it supports the theory and the research that suggests that Hunner's lesions are caused by viral infection. And since lactoferrin is an antiviral, it can then suppress that infection, and her bladder is responding. So I've had a handful of phone calls. I mean, we've only been talking about it for like since September or October. Lori says, does it help if you don't have lesions? Yes, because not all the patients in that study had lesions. Debbie said, you can easily get those dark thoughts when it's so on and off. One day you're great and the next day it's awful. Honey, I was there. I can tell you the exact day. July 4th, 1993. It was the worst day of my life. I was in so much pain. I couldn't sit. I couldn't stand. I couldn't lay down. The only thing I could do was pace and cry. And that was before I had access to pain meds. And it's very normal to have pretty dark thoughts on moments like that. And Penny said, it's over the counter, hun. Completely over the counter. If you go over to the IC Network website, let me get you the link to the article, because I went through all the research. I mean, so that the research was published a week after I had my double mastectomy. And so when I first read it, I was on massive pain meds. I'm like, oh, this looks crazy. It looks great. But I sat on it for 2 months because I had to make sure that I was really thinking clearly and understanding the research and all that sort of stuff. So I came back to it in September, and I'm ecstatic. Let me give you the link. That's the link to the article. Diane said, Oh, here, hold on a sec. Anne said, "For my last meeting, my last two colonoscopies, I made my own Gatorade, water, a pinch of salt, and honey. It was perfect." Hey, that's cool. That's great. And excellent. I need to add that. I think I already have it on my colonoscopy page on our website, but really glad to hear that you had no problems with your colonoscopy prep. Excellent. Diane said, "How much lactoferrin do you need to take a day for 4 months?" It's pretty expensive. The reason why it's expensive, and the one from Europe is twice as expensive. Um, uh, but we can't import it right now. We have to go through a bunch of FDA stuff to import it en masse, and it would cost six figures. Of which, because I've already talked to the company. Okay, so the protocol in the IC study was 1,000 milligrams a day for 7 days, 400 milligrams a day for 2 weeks, and then 200 milligrams a day for 2 months or 2 to 3 months. Now, the Valpath, which is the form of lactoferrin they used in the study, came in 200 milligram capsules. So, when I looked for a lactoferrin to carry in the IC Network shop, I knew I did not want an American lactoferrin because it comes from dairy, it comes from milk. And right now, we just have our milk supply is threatened by bird flu, and they're finding a lot of bird flu in milk, especially raw milk. There's warnings all the time now. So I did not want to bring an American product, a milk-based product, into the IC Network store until we had a lot more information. So I found a lactoferrin from Australia where there's no bird flu. And that makes me a lot more comfortable because bird flu, we just had our first fatality here in the United States of somebody. I think I think she was a 16-year-old girl who died of bird flu. Has much higher fatality rates than COVID, much. So I just didn't like. It's like I think there's a 50% fatality rate with bird flu. So I was just very uncomfortable bringing any dairy into our store. Um, so the lactoferrin that we have comes in 300 milligram capsules. So the closest we can to mimic that study formula is to do 3 capsules a day for a week, 2 capsules a day for 2 weeks, and 1 capsule a day for 2 months. And that's just, it's an experiment, it's a guess, but the research is so good for a small study. It's a powerful study. And this is the first study of a supplement that looked at the bladder both before and after treatment. And the bladders looked very good. I mean, the bladders went from red and inflamed to pink and healthy. And Hunner's lesions were almost completely gone. Like they couldn't find them in some patients. In other words, they might have seen where they might have been. But it was just very, very exciting. So, I mean, so that's 2 or 3 bottles, but it's only for 4 months. So it's an interesting experiment. I will also say that I'm working with an American company, Natural Approach Nutrition, who is interested in creating a lactoferrin supplement. I gave them the study, and they have been testing a bunch of different sources of lactoferrin. And so, and I trust them implicitly for for their research and their diligence. And so, when they have their lactoferrin study supplement, I'm sure that we will carry it, but it's just not available yet. All right. Did I miss anything else? And lactoferrin should not interfere with other prescription meds. Well, all right, you guys. I mean, you kind of slowed down on me. So let me make this offer again. If anybody wants to talk to me right now in person, we can go into Zillow. Why not Zillow Zoom? I've said that twice today. If you want me to start up Zoom, we can start up Zoom, and I'm happy to talk to anybody. If not, that's okay. All I've eaten today is a piece of toast. So I'm going to have to go eat something pretty soon. I had a piece of toast and I had my hot lemonade. Harriet says, I feel so much better since I found my new provider, though she has a therapist on site. I'll be saying, good. I'm glad. I'm glad. All right. Last call for questions. Last call for questions. Otherwise, knock on wood, we will see you next Sunday. And please send your prayers to everybody who's lost their homes in the fires and just been stressed by the fires. It's really, really like I've run for my life 3 times from these fires. And you try evacuating with a 100-year-old. Oh my God. My dad was hysterical. He's like, I'm not leaving until I see flames. So we have the first big fire, the Tubbs fire, 5,000 homes burned. Okay, like massive fire. And what was crazy, I'll never forget that night because it was a Sunday night. It was after I did my meeting, and I had a ton of work to do on that Monday. And so I was like in bed by 9 because I knew I needed to get up early, and the winds were blowing like crazy, and I could smell smoke. And my window was closed, but I could absolutely smell the smoke. But it's like, the fire was up in Calistoga, which is like 10, 12 miles away. And so I fell asleep. And my dad woke me up at 1:30 in the morning. And so how old was he? He was 95. So he comes in and he wakes me up and he shakes me awake and he goes, "You need to get up." And I was like, "Why?" He goes, "The fire is getting close." And I'm like, "What?" And so I get up. The air is horrific. The smoke is so bad. And what did he say? I said, so I was in my pajamas. We got in my car. We left mom asleep in bed because, mom was 90 and I didn't want to wake her up. So we get in my car. We drive down the hill, and like literally a block away at like 2:30 in the morning, there are people in their driveways packing up their cars. And I pull over and I talk to the first one. It's like, "What's going on?" She goes, "The fire's coming." And then I go down another couple blocks, and then I turn to my right at the end of, and I'm looking at the hills at the end of my valley, and they're silhouetted in red. And I can see all these cars streaming down off of the hill from all the ranches up over. And I'm like, and in fact, the 5 weeks, but they were going west. Well, so we come back home and we shake my mom awake and we get her dressed because we're thinking, okay, we're going to maybe have to evacuate. Now realize my dad is the one who, and my dad is also the one, I'm not leaving until I see flames, right? I'm not leaving. So anyway, we wake mom up, dad's home. I take mom in the car so that she can go see what's happening. And she's like, okay, this is bad. We come back home, but the fire is still like 4 miles away. And so we're thinking, okay, It looks like it's going the other direction. We're good. And then I don't remember. Did the power go out? They turned all the power off. And then, like the next morning, they issued these widespread evacuation notices, mandatory evacuations. So, I'm like, we'd never done this before. This was new. I'm an old hat at it now, but back then it was new. So what did we do? So I started packing for them both and organizing my IC network stuff. And my car only had an eighth of a tank of gas in it. I didn't have enough gas to evacuate them. So, and then the power was out and the gas stations didn't have power. And then I couldn't, and then my best friend was missing. Her power was out. And I'm like, where's she? Where's she? And then it turns out the power is on like 5 miles away. And I've got enough gas to get there one way. And so I drive and I get gas, fill it up, come back home. Now realize there's evacuations. They're all saying you got to leave, you got to leave. Well, I didn't have enough gas to leave. So anyway, I got the gas, come back, and my dad decides to do a temper tantrum. He's like, "I'm not leaving until I see flames." And my mom was like, "Well, I'm not going without dad." And I'm going, "Well, I can't go without either one of you. So thank you, dad. We're all going to die." That was kind of like my attitude. So then we find my best friend. She comes over to the house. She spends the night. And at 2 in the morning, we're all woken up by, like, my heart is beating because of this, by sirens, by a police car going up and down my street with a loudspeaker saying, "Get out now, get out now. The fire's here, the fire's here." You know, oh, holy shit. Sorry for swearing, but boy, does that bring back scary memories. That was so scary. And, we get my dad, finally, I'm begging my dad, "We have to go, we have to go." And we finally convince him to go. And we go up to my sister's house. And he was so angry that we left. It was a thorn in my side for 3 days. And then finally we revisit. I mean, they lift the evacuation like 3 or 4 days later. And my dad wanted to come right home, and I'm like, "No, I have to go down there first and look at it." And so my brother-in-law, we drive back down here to the house because this is the same house that I'm in now. And the fire had burned all the way up to the fence line behind the house across the street. I had my natural fiber mat at my front door had burned because embers landed on it. But it was on concrete, thank God. And the rest of the house didn't catch fire. And then dad wanted to come home. Most people, you hire a cleaning service to get rid of the ash, but my dad was like, I'm going home. Stop. You can't stop me. I'm going back to my house. He's the king of the ranch. You had to see his house. So we packed everything up, drove back the next morning, and the house was filled with ash everywhere. The ash came in through the floorboards, and we still didn't have power. everything in the refrigerators were bad. I had to try to come up with food. I had to clean all the ash from the house. You wonder, why did I get breast cancer? Well, maybe that's one reason why. I did that 3 times over 5 years. And, it's and then you have to balance that with just they announce it's a red flag alert, and so you're already sleep deprived because you're already up all night. Because you don't sleep on a red flag. Somebody in the family has to be up because these fires move so fast. The last one 2 years ago moved 8 miles in 45 minutes. And again, it was after a support group meeting. And I'm like, it was like a 5-hour meeting. I don't know why these fires happen on Sundays, but that's like the weird trend. I'd done this massive meeting here, make dinner for them, finally go sit in the recliner and breathe when I get the alert that the fire is on this in this hill group. And I'm like, oh man. I don't know where I found the energy, but I just got up out of the chair, came in, changed my clothes to my what I call my firefighting clothes, which are pants with a lot of big pocket, big cargo pants. And I just started packing everything up. And my dad was like, "What are you doing?" And I went, "The fire. We got a new fire." And he goes, "No, it's in Calistoga." And I went, "No, it's here." And you can call me stunned when 45 minutes later, that hillside right there was silhouetted with redness, and 5 minutes later, we saw the flames coming over the hill. And you know what was really interesting, Dad? I love you. I was actually at their grave yesterday, and I was talking to my parents yesterday. What was absolutely hysterical is that once he saw the flames, he was like, "Okay, we need to leave." And he got in his car and he backed it out, and he was in the he 99 years old at the time, shouldn't be driving, couldn't see a damn thing. He was determined to take his car. So he was in his Crown Victoria in the car in the road, idling, waiting for me to do everything. And and what was hysterical is that my mother, okay, so like my mother walked like this with her walker, right? Like she could only move her feet a couple inches at a time. So my mom was the perfect little old lady, barely able to walk with a walker. So I got them packed up. I've got and I put her in the family room to stage her there while I do a last run through the house. And the last thing I did is I pulled all the drapes off the windows because if there's a fire outside, the windows get so hot, the drapes catch on fire. And so here I'm tearing through the house. I'm pulling all the drapes off. I'm finally done. The car is packed. I walk back into the family room to take my mom to the car to evacuate. She's not there. She wasn't there. I'm like, "Mom, where are you?" She couldn't hear me because she was deaf. I go running back through the house. She's sitting on the toilet reading a book, which is what she did after dinner. Is she liked to sit on the toilet and read a book, even though, and she would be there for an hour, and it was just her thing. It was just her thing, and it's like, "Mother, what are you doing? We have to leave." And she's like, "Why?" And I'm like, "The fire's here." And by this time, the fire was halfway down the hill and very close to us, like literally, I don't know, 200 yards. on its way to our house. And she's like, "But can't I read?" She actually said, "Can't I read?" And I went, "No, you cannot read. We have to go now." I literally pick her up off the toilet, pull her pants up, grab the walker, get her to the, and then she can't to the back seat. She couldn't move her legs to get into the back seat. And she was like, "Just leave me. You can just leave me and go." And I'm like, "No, no, 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 no. I'm not going to do this. I'm not going to do this." So I get her into the front seat because my dad was supposed to be in the front seat and she was supposed to be in the back seat. So I get her in the front seat. So we back up and I realize dad is idling in his Crown Victoria. He does nothing to help. So then everybody's evac. So we drive down the hill, turn right, and the fire's right there. And my mother goes, "I didn't know it was so close." I'm like, "Mom, we've been telling you it's been coming for the last half an hour." Oh my God, guys. I have to stop talking about it. It's raising my blood pressure talking about it. Anyway, it's over. I have to tell myself I'm safe. I'm safe. Really big PTSD. See how my heart rate is. Oh, it's good. Yes. We live to be another day. All right, guys, I'm going to go. I think what I'm going to do is I just got a new puzzle. I've got a jigsaw puzzle I'm going to do, and I'm going to paint. I've already walked. So I'm just going to go make some chicken stew and I'm just going to chill. All right, guys. So I'll see you next week. Have a good one. If anybody wants to talk, go ahead and call me on Tuesday or later. All right. I'll see you later. I'm going to say goodbye to YouTube first. Bye, YouTube. All right, Facebook.